Right. Today also the topic middle cerebral artery. Middle cerebral artery is the most important. Why? It is supplied to the lateral side of the brain. The lot of main organs give the main arterial supply of the middle cerebral artery. Consider the hemisphere. Inside the hemisphere, the proximal area hemisphere. Proximal area and distal area, superior, inferior, supply of the middle cerebral arterial area. Why today also we discuss this middle cerebral artery? Due to damage of this middle cerebral artery, some form of hemorrhage, ischemic stroke, some form of pathological or some form of trauma and tumor, the arterial problem inside the brain. The cortex area, mainly consider the left side cortex area, compress the some form of hemorrhage, hemorrhaging inside the skull and cortex area. Right, we are going to draw some form of a small thing, a small skull and a small brain. This is the skull. Transverse tentorial, transverse and tentorial area. Brain stem. Cerebellum. Foramen magnum. Inside the cortex and skull area, this is the some form of hemorrhaging. There are some form of three layer: dura arachnoid matter, pia matter. Inside the dura the some form of damaged skull and dura collection of the venous arterial supply. Due to damage occurring in the arachnoid matter and subarachnoid matter, damage to the cortex and skull area, this area, collection of the arterial supply blood. Due to this hemorrhage inside the skull and cortex, compress the brain cortex. This is the midline. Compress the brain cortex. Compress the brain cortex to the midline. When this is happening inside the brain, the patient's intracranial pressure go up, some form of normal, 15, below, intracranial pressure go high. Due to this intracranial pressure, this is the area male herniation of this cortex is the left side hemisphere. This is the right side hemisphere. This is compress the singular gyrus to the away of the left hemisphere cortex area. Due to this compression, the mid side also the go right side. This is central area, ventricle also the go right side and downward. This is the central area. This is the subplasiny area. In this cortex also the compress this area. This is the cingulate gyrus. This herniation also the go downward. The ankle herniation. Cingulate gyrus compress the subplasiny to the upward, right side compress right side. The middle side of the brain. This is the CSF fluid collect ventricle, go downwardly and middle side. These are the cortex temporal area. The herniation to the brain stem. This is the most important point. Herniation of the brain stem. This point is the 1. This is this 2. This is the 3. This area is the 4. Considering the herniation of the foramen magna through the foramen magna, it is also the 5. 4, 5. Why we are talking about this herniation? The inside the brain, the middle cerebral arterial damage patient, when we are doing some form of exercise and some form of movement, activity, the therapists know what happened to the patients inside of the cortex and skull. The hemorrhage occur in this area, some form of hemorrhaging aggravation in this area. The lot of compression inside the brain. The therapist can understand this situation. That's the most important. Then we talk about this small point. So first we can understand the patient's ankle herniation. It is the most important to understand. 3 point, ankle herniation. is depressed, we can identify this point. Right, we are going to discuss one by one. So one is the subfalcine. False subfalcine. This is cingulate gyrus. This is herniation. Also, we can tackle some form of idea about this compression in the cingulate area. Consider the homuncle. This is the leg area. Homuncle, this is the leg area. When the some form of herniation occur in this area, the leg area can be understand to the leg more strips and its medial rotate, medial rotate the legs and strip and extend, and the dorsiflexion also the flex medially and downwardly. That is the some form of situation we can understand of this compression. Then central area, the second area was the central compression. Due to this central compression, the CSF fluid in this area, CSF fluid, then the arterial supply, the most important inside arterial supply, this CSF more product due to this compression, and arterial corridor, this is corridor supply, more aggravation inside this area, and CSF fluid products lot of in this area. This is the most important to central compression. Then go to the temporal area. Temporal area. This is the transverse calvaria, transverse tentorial. The transverse tentorial area. This is the divide the brain, some form of little bit portion. Transverse tentorial. This is the transverse tentorial. Is the bony component. A sphenoid bone, and connect the temporal area, temporal bone. This tentorial come to the medially and cortex go downward. This is the most important to discuss. This 3 point is the uncal herniation. While we are talking this uncal herniation, it is most important to understand the middle cerebral arterial patient. Now he is having some form of compression start inside the brain. How we can understand this uncal herniation? The externally, when considering the both eye, that's the most important. So both eye. This is the left side, right side eye. When the compression happen in this area. The contralaterally affect the body. The middle cerebral artery damage the contralaterally. The eye also the damage to the contralateral. But this is ipsilateral eye is some form of normal. Then the normal eye compress the uncle herniation. This is the compressed brain stem. Then the brain stem is the most important to discuss. Brain stem. Third cranial nerve, the oculomotor nerve. Oculomotor. This third cranial nerve is the oculomotor. This oculomotor supply, the mainly supply to the pupil, iris inside the eye, pupil. The pupil dilation and constriction, cranial nerve supply of the oculomotor nerve. Then we see this eye, the pupil not constrict and dilate. It is some standard level to fix. That's the another point also there. The oculomotor nerve supply to the eye. This is the motor supply, and another supply, the motor and some form of supply to the sympathetic and parasympathetic method. The oculomotor give the some form of this supply to the eyelid, connection of the eyelid. That's the most important another point, connection of the eyelid. When considering the left affected area, the right eye also the damage, the hemianopia occur in the right eye, but we can understand the good eye is always the movement eye. It is eyelid also the go downwardly. There's some form of symbol we can identify the eyelid movement. When this left side eyelid is moved to the some form of force. That's the first identification of the intracranial pressure aggravation inside the brain. Then we search this area, the some form of the little bit 1 day, 2 day after the both eye close. That's the another thing. The both eye close to the intracranial pressure high inside the brain. Due to compression of the uncle herniation to the brain stem, first signal go to the oculomotor nerve. That's the most important thing to uncle herniation. Then we are going to discuss another thing. Part 4 is a transverse calvaris, transverse herniation. Transverse calvarian. Another one is the uncle herniation is go the central side also, the upward compression also they have the crew compression of the upside. Then the another herniation downwardly, the cerebellum due to this compression come to the downward and brain stem and form medulla, and the cavity of the cerebellum area also go downward and go beneath the fossa, the foramen magna fossa go through the downward. Then medical emergency happening to in this area. Due to medulla, pons, and midbrain, these are the sympathetic and parasympathetic connection of the brain. The lot of cranial nerve, the 12 cranial nerve supply to this area. The lungs function and heart function and sleeping, reticular formation also happen in this area. Right, when we are talking about this intracranial pressure aggravate inside the middle cerebral arterial damage patient. The cingulate gyrus, the prominent area, and central compression. This is central CSF fluid area, ankle herniation, and transverse calvarium, the lateral side of the temporal region herniation. And fifth one is the cerebellar herniation. Alright, due to this reason, now we are going to discuss how we can understand the another thing to the externally understand intracranial pressure go upward. The first one is the third oculomotor compression. The third cranial nerve, the optic nerve also the compression. This optic, the lateral genicular body also the compression, the optic nerve. And oculomotor nerve is the compression. Some form of abduction nerve, some form of trigeminal nerve, trochlear nerve also the compress. Due to this compression, when the both eye close this patient, when we can test the open the eye and move his head, the lateral side, his eye also the some form of movement, we can track the intracranial pressure also the reduce. The eye not move, the intracranial pressure go upward. That is the some form of a small idea to get this intracranial pressure. The second one is the how we can understand the intracranial pressure high. Due to this reason, the parasympathetic and sympathetic supply activate inside the brain. Secondly, we can tackle the fever. Fever aggravating of this patient. Third, we can understand fever high of this patient. It is also the some form of sympathetic, parasympathetic, temporal temperature, and these are connecting together and go fever aggravation. Not only that, another thing we can to understand that inside the brain there are some form of internal capsule and external capsule. The external capsule also the compression. We can tackle the aggravation of the temperature inside the brain. Now considering the circulation of the brain, due to this compression, the main arterial supply of the brain is the supply lot of blood into the brain. We can see that this patient face is the reddish color, and sweating also the around the face, and some form of little bit movement and fix the face and mouth and eye and fix and relax. We can understand some form of skull pressure inside the brain. Why we tackle these things? The some form of middle cerebral arterial damage patient, he can't do speech due to speech center damage. The Broca's and Warmax area damage. Due to this reason, he can't do speech. So some form of speech improve patient. We can tackle the speech is go downward and concentration, orientation also the go downward. A little bit go away and hallucination and some form of things go up. That's the most important another thing to compress this area. It is also the most important, the third one, conscious and speech go downward and concentration, memory, and hearing problem, lot of aggravation of this internal compression. When considering this internal compression uh, go high, some form of 20 like 20, 30, 40 likewise. The more compression of the inside the brain, the lot of functioning are activated inside the brain. The main arterial supply go to the arterials to the inside the brain, and more glucose divide and more energy supply inside the brain, and carbon dioxide also the more supply to the venous return, and more substance to the waste products go to the venous pathway. In this happening in this thing, the brain supply to the heart, to the lateral arterial supply compression is the more important. Lateral arterial supply, these are the lateral arterial supply compression activated to the heart receptors. Then the lateral compression activate to the arterial supply, the major arterial supply dilate, and the major carotid arterial supply to the dilate and give the more blood to the brain, and middle cerebral artery area a lot of blood. The circle of villi are more highly work to the inside the brain. Due to this reason, the lungs also the some form of function activate. The heart also the some form of function activate. Due to this, lungs also the irregular method breathing activate to the give the more oxygen supply to the systole supply of the brain cortex and inside the brain. The systole supply more aggravated due to the brain artery supply. Due to this reason, there are a lot of problem happening inside the brain. Then what we are doing depressed, this is patient having some form of intracranial pressure aggravate the tracheal in this point. That this patient must position. Why it is most important? This patient is positioned to the bed. This is the bed, and this is the head and neck, the body and legs. This is a head raise 30-35 degree. Likewise, head raise is the most important to the patient position. 1 day, 2 day, 3 day likewise position to this patient head raised 30 degree. This is also a medical emergency problem, but we haven't the main surgery equipment. We haven't the main shunt applied to the remove the blood, and main blowhole applied to the remove the blood of the brain. We can't this thing to in this a small hospital. That is the most important point to the position the patient, the head raised and symmetrically, head, neck and trunk and leg. Due to this position, the most circulation supply, the brain circulation supply reduce is the most important. Then the relax the patient and the circulation supply of the brain reduction gradually, and the supply go to the downwardly, and 2-3 days rest position is the most important. Don't take to the main exercise to the patient. This is the another special thing to we have to discuss. The surgical equipment, knowing the some is small hospitals, we have to tackle this point, and position is the most important thing. When the another thing in this positioning, we have to tackle the how his conscious level, this the Glasgow Glasgow coma scale, GCS is the most important. When we are talking about the GCS level, this is the GCS level. We know some form of small GCS levels. This is the eye movement and the mouth movement and the finger movement and hand movement, and a voicely he can identify some form of thing, and symbolically identify some form of thing. These are the tackle this patient how to improve this level to some form of upward. That's the most important point to discuss GCS level and identify these patient. Come to the proper, so some form of good level, how we can understand this point to patient. Right, now we are going to the another thing. When we are doing the active exercise, the some form of a small point we have to tackle to how much compression inside the brain, the intracranial pressure go high. The patient is the position of the bed. This is the position, the head raised 30 degree, and the patient's arm. This is the some form of another symbol, arm, and some form of leg. The 30-degree position. When we move high compression inside the brain, the tackle the another point to the fix their arms to the midline and forcefully contract his palm, and thorax and abdominal area also the compress. Due to this compression is bodily out of this compression, the abdomen and chest area, thorax area and arm, and flex his elbow and twist arm. Leg also the same, full extends and the medially rotate, and the leg also the medially extend. This is the most important another point to understand the intracranial pressure high inside the brain. Then the patient's color also the change, sweating and high fever, and circulation supply also the check, we can check the pulse also, the we can check the hand with pulse, the diastole, the systole pressure, the diastole low and systole high. The systole high when the inside the brain also the pressure high. The in between this gap also the more gap, diastole and systole gap also the more gap, we can the heart sound trickle into these things. Then the intracranial pressure go high. The conscious level also the we can trigger. The some form of his arm also the good, or arm also the can mobile freely. He touched his head and compress his head middle side due to this headache aggravated this patient. Then the another parasympathetic sympathetic problem occurring inside the body,